here today at the Hospital for Special Surgery, Paramus Outpatient Center, talking about hips and knees. And I'm here today joined by Dr. DeFelice and one of his great successful patients, Ellen. First, tell us a little bit about yourself, Dr. DeFelice, and what you do here at HSS.
Hi, my name is Greg DeFelice, and at Hospital for Special Surgery, I take care of sports, trauma, and joint replacements, kind of in the mix with shoulders, hips, and knees. So I tell people if they tear it, wear it out, or break it, I've got you covered.
Sounds good. And Ellen?
My name is Ellen. I'm from Bergen County area. I'm a personal trainer and a group fitness instructor.
Ellen, now, how did you come to HSS and reach Dr. DeFelice?
I injured my knee in 2016, and so from September, my knees had been bothering me, and then I was teaching a pool class and just starting to teach a pool class, and I was coming out, just fixing the music, and something snapped, and I couldn't even stand on I couldn't put my foot down. So then I went to the ER, and they told me to go to find an orthopedist. They just gave me crutches basically and took an x-ray, and then I came here.
And were you surprised once you met Dr. DeFelice and heard his diagnosis? Were you surprised by that?
Something was seriously wrong. I couldn't even put my foot down. It was absolutely swollen.
Mm-hmm.
So,
and Dr. DeFelice, tell me about how she presented and what did that mean in terms of treatment?
The way she's describing it is pretty accurate. She came in with, well, basically what everyone would call a bum knee, and she's having a hard time putting her weight on it. And it was her description of her injury was very typical for what we call a meniscus tear. A meniscus is a bumper cushion that sits in the knee between the thigh bone and the shin bone, and it's there for cushioning. It's there to keep the shock absorption portion of your joint. And sometimes people, either young athletes or some kind of middle-aged like us, or even some older folks, will twist funny and they'll catch that meniscus and it'll rip. It's a very, very common injury pattern all throughout the United States and the world, to be quite honest with you.
And how is that typically treated?
Well, the first thing we do with everyone is try and treat them conservatively. And so a lot of times we can do some therapy, we can do rest and ice and elevation, the RICE protocol, so to speak. Anti-inflammatory medications will help. But then sometimes that's not good enough. Mm-hmm. And there's other times where you just have a big old tear in your meniscus and it's getting caught in your knee, and it makes it really, really hard to walk, and no conservative measures are going to sort that out. So there's times when you can go conservative, and then there's times when you need surgery. And hers, she needed surgery.
And what's the typical recovery period from a meniscus tear and then also surgery?
Well, again, what I really want to put forth here with meniscus tears is there's a dramatic difference between a 20-year-old with a meniscus tear from playing sports and a 70-year-old with a meniscus tear that's more associated with arthritis. And the younger and the more active you are, and the more it's a big tear that's causing mechanical symptoms, the better people do with surgery. And then the folks who are struggling more with arthritis and soreness in their knee, etc., a lot of times we can just treat those conservatively. Typically, as with Ellen, when we figured out that this one's not going to get better, we were lucky enough to get a good MRI so we could see the soft bits inside of the knee. And we have a nice MRI machine here in the Paramus office, which makes it super easy for folks. So she could just go down the hallway and get the MRI, and we had the info right there. Typically, if you have a nice tear like that, the surgery, what we call arthroscopy, which is done through several poke holes in the knee, where we inflate your knee like a water balloon and look inside with a little camera, and then we trim away the torn bits of the meniscus, or sometimes we can put a few stitches in there to repair it. If we trim it, the recovery is rather quick. The surgery takes a half an hour. It's a day surgery, come and go. And then you're in therapy for 4 to 6 weeks. If we stitch it and we're trying to get the meniscus to heal, that's a different story. That takes a little more time. and requires you to be on crutches for a while and protected and go slow so that the tissues can heal back together, that might take a little more like 2 or 3 months.
So in Ellen's case, which procedure did you use?
Well, Ellen, she had just the trimming, so
Okay.
she had what we call a meniscectomy, where you take away part of the meniscus, thus the name meniscectomy, and so hers was a rapid recovery. But she has another twist to her story, which
Right.
we can get to. This is why we're here on Facebook Live.
Sure.
When I came in with my knee, I said, could you please just check my hip while I'm here? Because I didn't realize you had the MRI here, and I thought I was going to be sent to an imaging center somewhere else. So then he checked my hip at the same time, and when I had the reading for the MRI, he looked at my hip and he said, total hip replacements.
Without a doubt. What did you
Yes.
see in her images?
Well, it's not just what I saw in the images. It's also, listening to her story, and probably a good reason that she tore her meniscus is because the rotation and the motion of her hip were limited because of the arthritis in her hip. So, I think we all think about folks, as we get a little older in our 70s and 80s, we think, oh, arthritis is very common. But the fact of the matter is there's a lot of folks out there in the much younger decades who have arthritis, either just because of genetics and bad luck, or because of injuries when they were younger, and they can develop a really bad arthritic joint that's stiff and painful, and causes you to walk with a different gait and put stresses where they shouldn't be, resulting in a meniscus tear. So when I examined Ellen, we could tell immediately that she had very little range of motion of her hip. And then, on the physical exam, I knew that when I put those x-rays up, it was going to show that she had an advanced arthritis in her hip. And sure enough, she was pretty much bone on bone in her hip, which was, adding to the woes.
Were you surprised, Ellen, by this diagnosis?
No, I had been to see doctors for probably 10 years about my hip. It had been bothering me. But most recently, probably the year before he replaced my hip, I had seen a doctor because on top of the arthritis in my hip, I had also torn the labrum. I don't know, there's cysts or something that can develop, or spurs or something in your hip, and maybe that tore my labrum, but that would hurt all the way down my glute and wrap around into the front of my knee.
Wow.
And besides that, I had no stability in that joint. So fine, I had no stability, but then going down the steps, I could just absolutely lose that joint. Or on the treadmill, I would lose it and then worry about falling. I had no range of motion, and then I gradually started losing strength in that leg. So even going up the steps is not as easy either.
Is what Ellen describing typical of when you see deterioration in the joint?
Sure. I think, the joint is normally a nice smooth articulation where it's covered with nice smooth cartilage, kind of like the tires in your car. I usually use that analogy when I'm talking to people about arthritis in the joints, is that the cartilage on the end of the bones is like the tire on your car. And if you're driving around on the rims, that's not a very pleasant experience. So when you have bone-on-bone arthritis in the hip, you're always kind of struggling. You don't have the standard mobility, so your back can start to hurt, your knee can start to hurt, you tear up your meniscus. A lot of people get arthritis on the opposite knee because when they walk, they're limping and swaying side to side, putting stress on the opposite knee. And so, again, there's this thought process and understanding of arthritis in America and in everyone that, if you have arthritis when you're young, just wait, don't have the surgery, whatever you do. And that may have been the way it was many, many, many years ago, but at this stage of the game in the year 2018, we're 6 generations of evolution into the joint replacement experience, and at this point we're pretty darn good at it. And I tell people, and I told Ellen, there's a time for conservative treatment, and then there's a time where, surgery actually is the best treatment. And although it's a little aggressive to say, hi, how are you, you need a hip replacement, I agree, it's the absolute best thing because it prevents falls, it allows you to move in a more fluid manner so you're not stressing your other joints. In her particular case, she's an extremely active individual. She teaches all sorts of yoga classes and fitness, and she can't do the things she wants to do And what are you going to have her do? Wait until she's 65 or 70? Or are you going to enjoy your life now and get on with it? And so the technology is great now. You're at the best place in the world for joint replacement surgeries. We do more joint replacements at the hospital for special surgery than any other hospital in the entire country, potentially the world. And this is a great place to be for this type of problem.
Right.
But of course, we had two problems. We had the knee and the hip.
Right. So talk us a little bit through what that was like for you mentally, because now you have to prepare for surgery. And what did you have to do, or what steps did you have to do?
I didn't worry about the surgery.
Yes, exactly.
And I worried about the only things that I could control.
Right. Correct.
Since I had been to physical therapy already for my knee, she had given me exercises to do to get ready for the hip replacement, so that I would be ready for that surgery. So my daughter says, you're the only person in the world I know that trains to go in for surgery. But I just wanted to have the best possible outcome on the other side. And beyond that, I just, cooked a lot of food so I would have the right thing to eat, and I rearranged the drawers because I knew I wouldn't be able to be breaking 90. And anything else that I could do.
To prepare.
Yeah.
But look, that's a great thing, So it's all about team, right? So at HSS we've got great teams that it works the best. But doctor patient, we're a team, and I tell people all the time, you're coming in. Here's the deal. You and me together are going to make this right, and are going to make your life better. And she's a perfect patient. She comes in, she's fit, she's working on it, she understands, she goes out and she's training before she comes into surgery so she can optimize her outcome by bringing her best game forward. I'm going to bring my best game forward every time. You're trying to get the best results for every single patient, but I can't do it alone. My surgery's done with, and then the hard part comes, and she was up to the task, and she got it done, and she wins, and we both win. And we can celebrate the wins, which is, I love what we're doing at HSS with the back in the game stories.
Right.
She put hers up there, and I tell all my patients, I say, tell your story on back in the game. And this isn't to make me famous or rich or whatever it is. This is about inspiring other people out there who are sitting on the sidelines of life because of an injury or arthritis or whatever it is, and they're too scared to come into surgery. These stories are about inspiring other people to get themselves fixed, get on with life, and enjoy what it's about, right? I mean, that's what these things are about. And she's a great example of this, and this is why we're sitting here talking to Facebook Live.
So, Ellen, now that I don't know if you're fully recovered or from your surgeries, do you feel that way? Tell me a little bit about how you're doing.
I do. So I was probably back in the gym 6 or 7 weeks after the surgery, and I let my classes know. I'm like, these are my limitations. They're on for 3 months, and that's what I'm going to do. I'm not going to break 90. I'm not going to cross right over left. I'm not going to have my knee higher than my hip. I'm going to demo the move, modify it. I'll have a stunt double do the move for me, but I'm not going to do it. And then once that happened, then I was able to try different things. I would experiment in the pool with jumping. It felt good in the pool, then I would try it on land. You know what I mean? I would just progress the exercises to see where it was a good place to be. Always listening to my body, always trying not to go further. And if it didn't work today, then I'd pull back, and then I'd go back and try it again later.
Now, is this the typical thought process of patients, or it can vary?
Oh yeah. Well, I mean, look. It all gets down to what kind of shape you're in coming in, how old you are. So some people struggle a little more. Some people struggle a little less. Hip replacement surgeries do tremendously well. They're known amongst the arthroplasty surgeons as the ones that are super smooth. Knees are a little bit more tricky. I also do robotic partial knee replacements, which is an alternative. So we try and right size the surgery for each person's problem. Right? We don't just go in and do one size fits all surgery. You have this, everybody gets that. Personally, I have a less is more approach. Right? First of all, I'm only going to do surgery if need be, and I'm going to try and do all the non-operative measures before we commit to surgery. But if you come in and you're an obvious surgical candidate, I'm also not going to dilly-dally and waste time with a bunch of measures that I know are not going to help, for example, with her bone-on-bone hip.
Correct.
Now, we knew she was having symptoms. Could we have tried some injections, etc.? Sure, but that's not going to change a 50-year-old, 20-year-old, right? 25-year-old. That's not going to change. That's not going to change. It's not going to move the ball far down the field. Right. We're still going to be coming back in a very short amount of time because it's super debilitating in this age group when you're that active. So we went right towards the hip replacement. So her, when you're at this age, the hip replacements, they get up and go because they're strong, they're fit. A little older, it takes a little longer because you're not quite as strong, and you may need a little more rehab, etc. But yeah, I think in general, the hip replacement's really an unbelievable option. I typically describe it as the single greatest surgery in the history of the world. So,
Ellen, tell us a little bit, walk us through that surgical period. So you came to HSS, you know that you had to have surgery, you're confident in your physician. What can you tell us about some of the services that you received while you were at the hospital and how that also affected your outcome?
Even before I ever went in, they called me the day before the surgery to set everything up. It was like every person that I talked to had all the time in the world to talk to me. Like I was the only patient that they had to talk to. In both surgeries, in both cases, you know,
and that made a difference.
Yeah.
Don't promise too much for your doctor here, because
they did though. They did.
I know they did, but I don't always have that much time.
But you could say that I guess, like you were saying, that teamwork, that's always important to making patients feel good about their care, and with you, Dr. DeFelice, in helping patients reach this decision, you talked about the fact that it's a team approach. Do patients often understand that they have just as much to say about their care and what happens to them, and then also talking to you about that decision-making process, that they have a voice in there?
Oh, sure. I mean, look, I tell everyone, folks who come in, like say, for example, take the knee with the meniscus tear. You know, a lot of people ask me plainly, do I have to have surgery? I said, no, you don't have to have surgery. You're not going to die from this, right? And there's a lot of different mindsets about surgery, right? A lot of people come in and they have incredible trepidation about the possibility of surgery, and they're so terrified of having the procedure that we don't even touch that topic. Even though I know they might do better, I understand that they don't feel comfortable with that. And then there's other folks who come in with the attitude, just fix it, doc. I don't want to wait around.
Right.
And so, look, I mean, this is what we do, and this is why medicine's an art, and, you know, we try and make it as much of a science, but each person's different, and each person needs an individualized approach. You know, Ellen was, fully active, and her big problem was that she couldn't be active.
Right.
So what's going to help her out is fix her knee, get that done with, and then fix her hip, and now she's back doing the things she loves to do.
9 weeks apart.
Yeah.
So now that you're back to doing some of those things that you like to do, can you show us some of those things that you feel are very important to your health right now and keep you feeling good?
Oh, you want me to do
yes,
my demo?
A little demo.
Do we have to give a disclaimer? Don't try this at home?
Yes, you can say
We hope we don't fall out now, right?
You're not allowed to fall.
Okay.
I haven't seen this yet.
You didn't?
This is impressive.
So this is the repaired knee that I'm standing on, the repaired hip that I'm moving, right? There's the door. So then the other side. This is the hip.
Awesome.
We got it.
And I would like to say that I'm not going to do that.
You can do that next.
I cannot do that.
Right.
So all the parts are working.
Well done. Well done.
And when you see your patients come back and they're doing well like this, what does that mean to you as a physician?
Ah, come on. That's why you did it, right? That's why you spend all those doggone years in school and studying it when everybody's else out and having a good time. And I can't even think about how long that was. But you do it for these are the wins, right? I mean, we just got through the Olympics, and And you're watching the pride with which everybody's up there with their medals, or even the pride of competing, right? Mm-hmm. And this is really where it's at. These are our gold medals in what we do at HSS. That's why I love the back in the game stories, because to be honest, it doesn't matter if you're a yoga instructor or a pee-wee football player or a high school athlete, college, pro. To be honest with you, if you look on my back in the game page, I have a picture with a little old lady, an LOL I call them. We laugh, have a good laugh. And every time she comes to see me, she brings me a plate of scones. And she's an elderly Irish woman, and she makes scones, the best scones you've ever. I don't even like scones. And she brings scones, and I eat them every time. And she told me what happened. She fell, and while she was making scones, and the fire department came in, and she tore her rotator cuff, big old tear of the rotator cuff, and she couldn't get up to finish the batch of scones. She made the fire department guys wait until the scones came out of the oven to take her to the hospital. Oh, wow. And then we fixed her shoulder, and she was back. And the first batch of scones she was able to make, she brought them to, and we had some, and we took a picture, and that's her Olympics, right? So it doesn't matter what walk of life. And it's funny, I trained at the Hospital for Special Surgery and Orthopedic Surgery, and I did a sports medicine fellowship, and I used to say, I'm a sports medicine doctor, but I did a lot of trauma surgery too, because a lot of sports injuries are trauma injuries, and it was kind of broad, and then I didn't want to, leave out the folks who were the aging athletes who had arthritis, so I kept doing joint replacements, so I have a pretty broad practice. But I say to my patients that it's not. I'm not a sports. Life is the sport, right? It's not that. It's just I only take care of these athletes. Life is the sport. Whether you tear your rotator cuff painting a ceiling, or you trip and fall, you go into your grandkids' baseball game. It doesn't matter, right? Because everybody wants to do what they want to do, and that's why these are the things we celebrate, and that's why we're here today. So.
And Ellen, to you, tell us just a little bit about, since the surgery, how your life has either improved or it stayed the same, but what things you feel you're so happy to be able to
it gets so much better. So I was so lopsided. We're all a little lopsided left to right. You're not equally strong or flexible on one side to the other, but I was like a disaster on the right side, And it's I'm so much more evened out since I had the surgery. And the leg gets stronger like every day. So even though I said I was fully recovered, every day, even if it's just that much, it gets that much stronger every day. Because it's stable, and it will hold me up now.
Right. And you also work as a personal trainer as well. So what are some of the things that you may notice about your own clients?
So the thing is, so now that I have a different perspective, right? So I spend so much time in physical therapy and seeing all of this, and a lot of my clients are 60 and up, and they kind of need the same kind of adjustments and tweaks.
Right. And how do you also have shared some of what you've learned, going through this situation yourself? How have you applied that to how you work with your clients?
Well, a lot of the exercises I had done in PT, I will bring in and use them on a lot of my clients. And now I'm looking at people, seeing how their hips are lining up and seeing how their knees are lining up and seeing where their shoulders are, and trying to modify exercises for people to accommodate whatever is going on.
And when you look back through this entire journey that you've taken to come to this part in the surgery, were you happy that you made that decision, or do you ever look back and say, you know what, I wish I had done it a little sooner, or no?
Oh, sooner maybe, but every day I'm happy that I did it. Right. I don't regret having done it. Right.
And what would you say to some people who are maybe thinking about taking that step and maybe a little bit hesitant?
I would take the step. I wouldn't wait. I mean, how many other injuries do you want to have? Do you want to hurt your other knee? Do you want to hurt your calf? Do you want to have Achilles tendonitis? Do you want to have, you hurt your back, throw out your back, because it goes up the whole kinetic chain. Right. And then once this gets fixed, the whole kinetic chain is reset for you.
So, and Dr. DeFelice, I know that you touched upon this before, but I just think it's worth repeating again. When does a person need to make that decision for themselves?
You know, I think I think about this all the time, and I think about how to get the message out to the patients. And my thing is I want people, let the pros make the decision. Don't sit at home and Google everything and try and figure out, you know, self-diagnosis and what's going to happen. Just come in and ask the guys who spent their whole life studying this, and we'll give you the straight answer. You're fine or you're not. And I think that now, you know, the Hospital for Special Surgery is such an unbelievable resource out here in North Jersey. I grew up in Upper Saddle River, up the street. You know, we had a big family. We all went to one of the local high schools, Northern Highlands, go Highlands. And I always wanted to come back out here to practice, but we never had the option. And then the folks up here didn't want to traipse into New York City to get seen at HSS. So now that we have this outpatient center out here, it's tremendous because you get the best of both worlds. You don't have to go all the way in to be seen, and yet you can get the world-class care. You know, like I mentioned, we do more surgery at HSS than some entire states. And we've got 120 or so orthopedic surgeons on staff, and you know, as far as these hip replacements and hip joint replacements, we do almost 15,000 of them a year. Now, you get pretty good when you're doing that many. And so I tell people, you know, don't sit around and let weeks and weeks go by, like after an injury, if you fell and you can't lift your arm. Just come in and let us decide, because some things do best when they're operated on immediately. Now, arthritis is a little different story. Each person's a little different as to when they pull the trigger on, I've had enough. Right? And so that's one's a little different. But, you know, come in and see the experts and let us educate you as to what you're dealing with. Sometimes, to be honest, you wait too long. And then, you know, one of the first patients we had here at the Paramus Center was a fellow who came in who was hit by a car like 25 or 30 years prior. His leg was really crooked. He was turned in. His hip was horribly arthritic. And he'd just been putting it off and putting it off and putting it off. And we were able to get him straightened out. And it was really a great win for the first patient. It was the first patient here. But, you know, sometimes we wait too long because we're too scared. Again, I get back to telling these stories, sharing this all on Facebook so everybody can get back in the game and enjoy life.
And since you talk so much about the Paramus Outpatient Center, can you just talk a little bit about the services that are available here and physicians that can be seen? Sure.
You know, we've got basically everything covered. We've got rheumatology, we've got spine, we've got hand, we've got foot, we've got sports, we've got joints. So we got the musculoskeletal system covered from head to toe. Imaging, we've got MRI imaging, a beautiful 3T scanner out here. We've got the best images that you can get. And then, and you know what? People don't think about that, right?
Right.
And as orthopedic surgeons, we know there's a big difference between a good scanner and an scanner. And the way I describe it to my patients is the difference between a good scanner and an okay scanner is like the difference between getting the pictures taken by the wedding photographer or the people who are shooting with the little throwaway cameras on the table. And we all know what those come out like, you know. So, and then we also have great therapy here, so you can have your surgery and then you can just do your therapy here. So it's good for us, the surgeons, and to keep track of how patients are doing.
It's fantastic. Well, I'd like to thank you both for joining us today and sharing your story, Ellen. I think it will show as an inspiration to many, but also help them when they're looking to make that decision. And Dr. DeFelice, thank you for taking care of Ellen. And to read more about Dr. DeFelice and also Ellen's story, please visit hss.edu/back in the game. Thank you for joining us today.